All right, good morning. It's good to see you. How are you doing? It's another new week. So I trust that you're starting a week on a positive note. But other than that, thank you so much for joining us. This is My Doctor, and my name is Winnie Lubembe. As always, it's a pleasure to have you on board. You want to stick around till the end of the show for you to understand more about the topic of discussion today, and that is on epilepsy. And you know, epilepsy accounts for a significant proportion of the world's disease burden, affecting around 50 million people worldwide. And of course, globally, an estimated 5 million people are diagnosed with epilepsy every year. So that's a very, very big number. And of course, most of us, sometimes we understand epilepsy, but most of the time we don't. And of course, this is a condition that we all know in Swahili as kifafa, all right? So, and I'm pretty sure you've seen someone or you know someone who has or is living with epilepsy. Sometimes it's difficult because the back then levels of stigma was really, really high as far as, and especially towards people with epilepsy. Do we still have the cases right now? Well, you want to stick around to find out more, you know, on the same. But if you have a question, feel free to call us live. 0791-478-990 is the number to call through, or send us a text message on 40920. We'll be looking at your questions, concerns, clarifications in a while. But for now, let's meet our guests for the day. So we have gentlemen on set today. So good morning.
Good morning.
It's good to see you both. Karibuni sana on set. And we'll start with you, Joshua. You've been here before and then you disappeared on us. But we're glad you're back. So before we get into the discussion, please say hi and tell people who you are.
Okay, my name is Dr. Joshua Rua. I work with Bliss Healthcare.
All right.
Yes.
Karibu sana. And on to you, Festus. Wewe sasa ni mgeni wa leo. Welcome to the show. And tell the people who you are and what you do.
Hi, naitwa Festus Maronga na natoka Gashie na mimi ni mwanabiashara.
Okay, karibuni sana. All right, so Festus, you are diagnosed with epilepsy. Yes. But before we get into that, I think, can we just understand what epilepsy is? Because like we said, sometimes people see, especially when someone has a seizure and people don't understand what is going on, what do we do in the event that one has a seizure? So I think we can just start with the basics. What do we mean by epilepsy?
So epilepsy is a disease that primarily affects the brain. It's a brain disease. And what happens is that your brain has electrical activity. So normally there's a way that is controlled, but in epilepsy you find excessive electrical activity.
Okay.
And then it manifests either as an uncoordinated movement of the arm or limbs. Some people lose consciousness, or all that manner of symptoms that come with the disease that we call epilepsy. So it's a brain disease, if I can call it that.
Okay.
Yes.
All right. And you see, when you say a brain disease, most people are scared. Like anything to do with the brain,
Yeah.
it's a no-go zone. We do not want to talk about it. Do we know what causes epilepsy? Because I think for most people, and for a very long time, because I've seen someone with epilepsy, and back then where we used to say, people used to say, uyo merogwa. You see? So people associate a lot of cases of epilepsy with witchcraft. So let's just set it straight today.
Yeah.
What are some of the causes for this thing?
So yeah, maybe I'll just point out first the stigma. Yes, the stigma has been there even historically, as if you look at the history of epilepsy, not just in Kenya, but all through societies. In some countries, in fact, I read even in the UK, there was a time when it was grounds for divorce. It was a valid ground for divorce. And in our society, mostly it's considered to mean that you're possessed. Even the word epilepsy itself comes from a Greek word that means possession or being seized. So there's always been that notion historically that this thing has got to do more than just the physical.
Yeah.
But when we look at the causes of epilepsy, we can actually point to a cause in a good majority of the cases. You can actually point at the reason why the person has epilepsy.
Epilepsy, okay.
And the commonest ones will be things related to injuries during birth or during the pregnancy.
All right.
So when the mother is pregnant, sometimes they expose themselves to some drugs, including alcohol, that could also lead to epilepsy. Or during the time of delivery, if it was a difficult birth, it could lead to epilepsy later.
Okay.
And then in other people, you also find some risk factors. For example, people who come from a family where there is epilepsy, that family history itself is a risk factor because of some genetic explanations behind it. And then in the secondary causes will also include people who've had stroke. They may later get epilepsy. People who've had any form of brain injury or head injury could get epilepsy.
Okay.
People who've had diseases affecting the brain, meningitis, malaria, and even some tumors in the brain could also present as epilepsy later on as a complication of that disease.
Okay.
Yes.
May. I like the term you're using, may. Because see,
Yes.
when someone hears malaria, epilepsy, we're like,
Yeah.
okay, sisikuisha, as long as you had malaria before.
Not all
no,
cases of malaria.
not all.
Yeah.
And yeah, it's a risk factor. It doesn't
Yes.
mean that you will end up with epilepsy. So I think the biggest thing that people want to understand is then how. And especially for, cases of meningitis, malaria, that affects the brain, stroke, what happens that then it might expose you or put you at risk of developing epilepsy? Does it mess up with, I don't know how the brain is wired, or what happens?
Well, trying to put it in as simple way as possible will be that when you get any insult to the brain, whether it comes from a disease or injury, there's potential that that area of brain that was affected may have permanent damage.
Yeah.
And so if, let's say, for example, today you got malaria and then it went and affected even your brain, there's a potential that that part of the brain that was affected could permanently be damaged. And once it has been permanently damaged, then it dysfunctions. You remember earlier I said your brain has electrical activity. So if a portion of it is damaged, that portion will not be doing is
sending the signals how it's
sending
supposed
signals
to and all those
correctly,
things.
actually.
Okay.
So that's as simple as I can put it.
Okay. All right. Because if we get too technical, we get lost.
Yeah.
All of us will get lost. Okay, then. So Festus, for you, ulikuwa diagnosed lini na kifafa? And because you see, like we said earlier on, when I think this is a discussion that we had before we came on air, where sometimes most of the time people will be like, you okay, and people tend to stay away from this person. Even the family members sometimes will lock their loved ones in because, again, stigma and all those things. So for you, yako ilianza lini?
Yangu 2012 ilianza, nilikuwa na depression na stress, lakini haikuwa inajulikana shida ni nini. Ilikuwa tu nataka kukaa peke yangu, sitaki watu. Kulikuwa na shida tu mingi na mimi, lakini sikuwa najua ama wazazi hawakujua. So until ikafika 2013 ndio nikakuwa diagnosed na epilepsy. After ilianza nikiwa shule. Na hata mimi mwenyewe sikujua. Nilikaa one night tukiwa tu shule.
High school.
Yeah, I was in high school. Ikawa usiku ikanishika na nikaspend like that whole night kama sijui ni nini inaendelea. So asubuhi ndio nilikuwa nahadithiwa shida ilikuwa nini. Na asubuhi venye ilifika niliulizwa sana ni nini kinaendelea. Mimi mwenyewe hata mimi nikamwambia sijui ni nini. Kwa vile hata mimi sikuwa experience kitu kama hiyo. Although kulikuwa na signs kidogo lakini sikuwa najua. Pia niliporudi nyumbani niliambia wazazi kulikuwa na shida kama hiyo, na pia mwalimu alikuwa amepiga simu nyumbani akasema, lakini hata wazazi hawakujua. So wakati niko nyumbani on April holiday ndio ili happen, mzazi akiwa.
Ukapata seizure.
Hiyo seizure ikakuja, mzazi akiwa. Yeye alidhani labda nimekuwa tu mgonjwa, akanipeleka hospitali. I was unconscious. For 4 days nikakuwa admitted.
Okay.
So ndio hapo ndio akaambiwa ni epilepsy. Mimi sikuambiwa, yeye ndiye aliambiwa. Na nikaichukulia ni kama waliogopa mimi kuniambia. So hata mimi hawakuniambia mapema. Kitu tu najua mimi niliambiwa ukiacha kumeza dawa utakuwa mgonjwa urudi tena hospitali.
Okay.
Lakini mzazi yeye alijua ni epilepsy.
Yeah. Okay, so can we just go back a little bit? Because umesema ulipata your first seizure ukikuwa high school.
Yeah.
But umesema before then ulikuwa na symptoms. So can we talk about some of those symptoms ulikuwa nazo? And when did you notice hizo symptoms? Was it when you were younger?
No. Zilianza 2012. 2012 ndio nilianza kunotice hizo symptoms.
Okay,
yani nikawa kuwa na vitu zingine sielewi hata mimi mwenyewe nini nafanya. Wakati mwingine sitaki kukaa na watu. Niko tu peke yangu, sitaki mtu aniongeleshe.
Okay.
Nikiwa nyumbani, mara mingi labda mzazi yeye aniongeleshe, lakini mimi either nitoke nikakae peke yangu. Sitaki kuongea na mtu. Nikiwa shule, mara nyingi labda darasani tu ndio nitaongea, lakini nitaongea wakati mtu ameniuliza kitu. Nikawa niko tu stress, sijui zilikuwa na zinatoka tu mambo na nyumbani, ilikuwa ni mambo ya kinyumbani tu. Ukuta labda mjaelewana na mzazi, ama ile maisha secondary unataka kuwa vizuri, lakini unaona kama mzazi hakuweki hivyo. So ikawa imeanza hivyo. Hivyo ndio ilianza, ikawa stress, depression, until ikafika mahali sasa nikaanza kuona niko na shida, lakini sijui vile nita explain. Ukijaribu ku-explain unaambiwa hizo ni vitu wewe unajitakia. Kwa nini unakaa peke yako? Kwa nini hutaki kukaa na wengine? Hivyo ndio ilikuwa.
Okay.
Yeah.
All right. And Dr. Oro, just take us through that aspect of, because you say most of the time, from what he's saying, I mean, we all get stressed. Life itself is just difficult for everybody. And people are stressed in so many levels, and then cases of depression. So could we say this is like a cause, or what happens?
Well, there's actually a link between depression and epilepsy.
And epilepsy, okay.
People who are living with epilepsy are, statistics say, 2 or 3 times more likely to experience depression. And the relationship goes both ways. Even those who are depressed are more likely to develop epilepsy.
Okay.
The science behind it is not very clear, but what at least we know is that some parts of the brain that trigger epilepsy are also involved in depression. So that kind of ties the two together.
Okay.
So it's possible that depression could precede epilepsy, or epilepsy could precede depression.
Depression.
Yes.
Okay. So is it more of plus other risk factors that then it develops or might cause epilepsy, or what happens? Because people would say, wait, I have been depressed or I am depressed. Does it mean then I will in turn get epilepsy?
Well, not really that it's that if you have depression,
cause.
it must then end up as epilepsy.
Okay.
No, that's not the case. What happens is that it has been seen that those who are depressed are likely to end up with epilepsy.
Yeah.
Now, it may be one of just other factors by itself, of course, but not the only factor that would
lead to getting epilepsy. Yeah. Okay, then. So for you, Festus, is there anyone in your family mwenye akona epilepsy, or have you ever encountered this before? Because like you said, for you, the first time you encountered a seizure was ulikuwa shule.
Yes.
Yeah. So in your family, like just looking back, is there anyone in your family?
Mimi sijawahi kuona. Sijawahi kusikia kutoka nyuma hivyo. Hakujawahi kuwa na hiyo kesi.
Okay.
Labda kaa ilikuwa wazazi wajue kutoka nyuma, lakini mimi sijajua kaa kulikuwa na kesi kaa hiyo, na sijawahi kuiona.
Okay. All right, so ukiwa shule, I mean, you see high school, so many things happen, and then you're still growing, you know, cases of esteem come to play and all those things. So for you, after your first, so ulikuwa, first of all, utaki kuongea na mtu, you are secluded, you wanted to be alone all the time. So I want to believe at that time, because people, watu walikuwa wanashangaa, okay, kwa nini anataka kukaa peke yake? And then all of a sudden, umepata seizure. So can you just take us through then, how was life in school after your first seizure?
Haikuwa nzuri sana. Na niwaambia mbeleni, mimi sikujua kama ilikuwa ni kifafa. So after nimeenda hospitali hiyo mara ya kwanza, wazazi wakaambiwa, nikaambiwa nimeze dawa, nikikosa nitarudi. Ikawa wakati fulani nimeacha kumeza. Kwa vile niliona mimi hata sijui na meza dawa na nishapona, siendi hospitali. Nikaacha kumeza, tena ikakuwa the seizures zimerudi.
Wow.
Sasa vile nilirudishwa hospitali, hapo ndio niliambiwa. Na kitu ya kwanza daktari aliniuliza, uliacha kumeza dawa? Nikamwambia nilikuwa nimeacha. Kaniambia, nilikwambia ukiwacha utarudi hapa. So hapo ndio alinikalisha, akaniambia ugonjwa wako inaitwa kifafa. Na hii itapona wakati utakuja mimi nikuambia wacha kutumia dawa. So vile aliniambia nikaiweka kwa kichwa ni hiyo. Na nikawa sasa nikirudi shule nilikuwa najua ni hiyo, na wakati ilianza kuhappen nikiwa shule wakati mwingine hiyo seizure ilikuwa kuna wale wanaijua. So ilikuwa ina happen, naogopa kukaa na watu mimi mwenyewe. Ikifanyika naogopa. Na ilikuja ikakuwa wengine hawataki kunikaribia, wengine hawataki kukaa na mimi. Kuna vitu mbaya zilikuwa zikisemwa hiyo wakati, unasikia mtu akisema sitaki kucheza na yeye, sitaki kutumia kama vikombe, vijiko pamoja, itanishika. So haikuwa nzuri sana hiyo wakati. Ilikuwa mbaya kabisa secondary, na until the time nimemaliza form 4 nilikuwa ikihappen ina lower self esteem kabisa. Sitaki ikihappen najitoa kabisa na watu, sitaki kukaa nao, inachukua like a whole week kama siko na friends kabla nirudi venye nafaa kuwa. Ilikuwa inakuwa vibaya sana.
Ulikuwa unaogopa all the time, like ni kama itakuja, like what if ikikuja, you know, like ulikuwa unaishi na hiyo fear, what if it happens now?
Yes, nilikuwa na hiyo fear sana. Ikihappen nitafanya nini? Ama ikihappen labda watu tulikuwa nao watanitoroka, ama nitaacha kukua na marafiki. Hiyo nilikuwa nayo sana, ninaogopa. Na sometimes ilikuwa ina happen hivyo, mko na watu then suddenly inakuja na maybe mtu atakushikilia ama kusaidia hapo, lakini ukiamka hutakuwa na rafiki tena. Unakuta wengi wameenda. So before uanze tena kufanya mtu aelewe ama hakuje karibu na wewe, inakuwa imekuchukua muda sana.
It's difficult. Alafu because at the same time mtu hataki kusema mimi ndio nilikuwa reason why alipata seizure. So wote wanaogopa. But now, was it triggered by anything? Like kuna kitu maybe ukifanya ndio maybe ina trigger seizure, ama ilikuwa inakuja tu sometimes umekiti tu vizuri unacheka with your friends alafu all of a sudden unapata seizure?
Mostly I know ilikuwa inakuwa triggered na kukasirika sana. Nilikuwa nikikasirika sana najikuta imekuja tu. Ama wakati mwingine nikigombana na mtu inakuja yenyewe tu, ama nikikasirishwa nikifikiria kitu sana inakuja. So unaweza kuwa labda kitu fulani kama mwalimu alikukosea kwa class then ukatoka, but hiyo kitu bado hujatoka kwa kichwa, inabaki tu. Ama asubuhi uliamka mzazi akakugombanisha, lakini unajua wewe si wa makosa. So ukiamka uko nayo, uko shule, iko kwa akili, so ina trigger hiyo inafanyika. Na mostly ilikuwa ikifanyika kwa shule.
Okay. And I can imagine, I mean, high school, like we said, high school is difficult. So and especially getting a seizure in school might be very difficult. So then in terms of, are there people who, because we're talking about seizure, I think we'll talk about that. Does it mean that everybody who has epilepsy would get a seizure? And from Festus's case, yake alipata like so many seizures at so many intervals, if I can say. So does it mean that everybody who has epilepsy will in turn get a seizure? But before we get to that, can we talk about some of the signs and symptoms so that people know? Because for Festus, alisema, hey, alianza notice the signs but didn't really know until he went to the hospital for the second time. Akaambiwa, this is your condition and you have to be on medication.
So the signs and symptoms, the commonest, of course, and the most dramatic usually is when somebody loses consciousness and they have jerking movements of their limbs, their hands and legs. That's very common, and that's what we actually call a seizure. But then other people also get other symptoms. Some people can actually feel that this thing is going to happen before it happens. So we call that an aura. So they can actually tell it's about to happen. And then after it has happened, for other people, they will also get they lose control of their bowels and their urine. So they might pee on themselves, or the stool will just pass on itself. In other people, they get what we call absence seizures. Absence seizures will happen in the person will just look a blank, like nothing really is happening, but they are absent-minded for a few minutes or seconds, and then they get back to normal. So that may be very subtle. It's only the person who may actually notice it at first. Other people may not notice it. Some people will get maybe just a part of their body, maybe the lips alone. They just mark their lips repeatedly, and that comes and goes. So for such less dramatic, people may actually not even know. It's only the person experiencing it that knows, well, this thing happens. And they may also not be able to explain it because nobody else perhaps has ever noticed it. And then in little children, you may see their eyes rolling or their tongues also rolling and such kind of things. So you just see a brief moment of the eyes just rolling and turning white, or the white of the eyes, what you're seeing. Yeah.
And then goes back to normal.
So not everyone will have the convulsion that we know of. Others will have some subtle ways of experiencing an epileptic fit, but all of it is still under epilepsy.
Okay.
Yeah.
And we talked about earlier on, because for Festus's case, he realized that he had epilepsy when he was much older.
Yes.
But right now we're also seeing a case of young children with epilepsy. Can we talk about that a little bit? How often or at what age are they mostly diagnosed with epilepsy? And then the symptoms, do they start as mild and then probably progress?
So the typical person will mostly be young children. And for them, you can actually tell when you look at the birth history, perhaps it was a difficult delivery. That's usually the commonest for most children you see with convulsive issues.
Yeah.
But then the others who get it much later, maybe as young adults or even later in childhood, in their teens and stuff. So for such people, you'll get probably there was also something else, like the things I mentioned, maybe malaria, or they suffered meningitis and they were treated. And after the treatment, a few months later, they started developing the fits.
Okay.
And then also the other age group, the elderly, those ones now you get the disease of aging, things like stroke, for example, if somebody gets a stroke and then later they get epilepsy as a result of the stroke. Again, in children, something I failed to mention is also you may get some children who have structural abnormalities in their brains. So they were born with brains that were not well developed, and then that presents as epilepsy. So it affects the whole spectrum of age. The causes may vary a little depending on the age.
And it doesn't choose. Anybody can get it. Okay then. So for you, Festus, from Dr. Joshua, I mean, kuna watu wengine wenye wanaweza, they can tell when they are about to have a seizure. For you, did you probably know at some point, ama ilikuwa inakuja tu?
Mapema kabla, naweza sema kuanzia hiyo 2013 until 2015 sikuwa nikijua kuwa itafanyika. Lakini kuanzia 2016 nilikuwa nasikia inataka kukuja, lakini unajua inafanyika in seconds, hata huwezi jua kuwa ama ujizuia. Dakika moja ishafanyika. So nilikuwa nasikia, nilikuwa najua inakuja.
Okay then. So after ulirudi hospitali the second time and then you were told now you have to be on medication until daktari akwambie when to stop. So of course you have to ilibidi umeze dawa. So after kumeza dawa, did you notice a difference in terms of the first time before kabla wache dawa, zilikuwa zinakuja after how long, and then after umemeza dawa, did they reduce ama ilikuwa bado the same?
Yes, zili reduce na ikawa sasa inaweza chukua hata miezi 6 kabla haijafanyika. Au inafanyika mara moja kwa mwaka, mara 2. Ilifika ika reduce kabisa.
Okay. And before then ulikuwa unasema ulikuwa unconscious. Ukianguka haujui, the following day ni watu walikuwa wanakuambia this is what happened. Walikuwa wanakuambia nini exactly, like what would happen hiyo time ulikuwa na seizure?
Walikuwa kama hao waliniambia shule, waliniambia lianza tu kutingika, nikaa kujitingisha, nazunguka kwa kitanda, niko na nguvu ile yenye hata kunishika hawezi nishika nitulie, inakuwa kujizungusha tu, then after some minutes natulia, lakini still bado nikaa kuna hiyo kujizungusha zungusha
Kidogo. Okay.
na wanasema nilikuwa naongea vitu zenye hazieleweki. Nasikia tu nikaa naongea lakini hawajui ni nini nasema.
Because most of the time, sometimes I would see, and especially if someone had a fit, mtu anachukua kijiko, anaweka in between. I don't know if that used to happen to you. Mtu anachukua kijiko anasema so that you don't bite your tongue. Usiume ulimi. So, mtu anachukua kijiko anaweka in between. Sometimes people would be given things like glucose. I don't know why, but yeah.
Sikuwahi kuwa na hiyo. Sikuwahi ambiwa kaa kulikuwa na hiyo
kijiko or anything. Yeah. Okay. But you see, sometimes people might be like, okay, so what do we do in the event that one has, a fish? What do we do? So I think we can start with what to do and what not to do, because people panic and people might run away, or people would try to help, but in trying to help, they make things worse.
Yeah, true. So what we will advise, if you're with somebody who's experiencing a convulsion, not just epilepsy, any type of convulsion, we usually tell our patients that, or whoever the caregiver, you should put the person in what we call a recovery position. Okay. The recovery position is they lie on their side. And the reason for this is, of course, you make sure they're in a safe place. If they were maybe cooking or something, just remove them from anything that could harm them.
Yeah.
And then put them on a flat surface and they lie on their side. You probably at home, you may not be able to do more than that. And that is good enough.
Okay.
Because the reason behind it is that when somebody is having a fit, they may choke on their own saliva. Or it may, basically it may go into the lungs and cause more problems. So that is what you can do at home. Now, there's generally what people used to do and used to be encouraged, and I think the notion is still out there that when somebody is fitting, you take a spoon or whatever and try to put it on their mouth so that they may not bite their tongue.
Yeah.
However, the danger with that is in trying to put something inside the person's mouth when they are convulsing, you may actually trigger them to vomit.
Exactly. And can we take a very short break? When we come back, we'll explain why.
Okay.
Because I think most of the time we always think, this is us helping them not to bite their tongue and all those things, or even injure themselves, but it could be fatal.
Yeah.
All right, so taking a very short break. If you have a question, feel free to call us live 0791 478990, or send us a text message on 40920. We'll be right back with more on epilepsy. See you after this very short break. All right, welcome back. Glad you're still with us. This is My Doctor. Just in case you're tuning in right now, today our focus is on epilepsy, or in Swahili, kifafa. All right, and I'm pretty sure, like we said earlier on when we started the show, you know someone or you've seen someone who had or who has epilepsy, and probably experienced someone with seizure. And most of the time, people don't know what to do. How do we help this person? Or whatever we do, are we doing it right, or are we making the situation worse? So it's a lot of complexities, surrounding epilepsy. But today we're trying to make it easier for all of us to understand and what to do in case one has a fit. What do you do to help them so that, again, they do not end up, harming themselves in one way or the other? So if you have a question, feel free to call us live on 791 478 or send us a text message on 40920. We'll be looking at them shortly. But for now, before we went for break, Dr. Joshua, you were telling us about the aspect of someone might actually choke, or if you put something in the mouth, they might end up, vomiting. Yeah. So could we continue this?
Yeah. So we're saying one of the things you should avoid, and that's a common notion, is trying to put things in the mouth of the person who's convulsing in an effort to try stop them biting their tongues.
Yeah.
Because there's a high risk you could induce a vomit, and then this person will choke on their own vomit. And so we end up having done more harm than good.
Yeah.
So in brief, what I will just say, if today I got a patient at Bliss where I work, and then I was to talk to their caregivers, I will tell them that at home, the much you can do is ensure this person is in a safe place, put them in a flat ground, and then, because most of the seizures don't last long, once they're there, put them in the recovery position, meaning they lie on their side.
On the side, yeah.
And you can call for help if you can, if you're having people, or rush them to hospital as fast as possible.
Okay.
Something else that nowadays people can do is which helps doctors actually in diagnosing, is if you have more than one person around, you can actually, especially if it's the first time that somebody is convulsing, you can actually record the convulsion if you have a phone.
Okay.
Because there are many types of convulsions and
might not necessarily be
so if you can actually have an extra hand somewhere around there as you try to help this person to get to hospital, you could actually record it. It may be very important for the doctor in reaching a diagnosis of what type of epilepsy actually this person was having, what type of convulsion this person was having.
Okay.
Yeah.
All right. But then again, that aspect of this person is too strong.
Yeah.
Sometimes the people who are there trying to help them might not be able to. So then what could happen in the event that someone is not, or probably one has a seizure and nobody is around, to help them? What could happen in the event that, nobody helps or nobody is there to help them?
I think the greatest risk is physical injury. Yeah. So if somebody was in a place that there's a high place, they could fall. If perhaps they were swimming, they could drown. If they were next to a fire, they could get burnt. So that's the greatest risk that we fear for someone who has epilepsy.
Okay.
And then, of course, if probably they were also in a position where they've choked on their own saliva or vomit, then it could also lead to difficulty in breathing. Yeah. So those are the greatest things we fear for an epileptic person living with epilepsy who's alone or who is with someone who can't really assist them that much.
Yeah.
Yes.
Okay then. And Festus, for you, ulikuwa unatuambia there are times unaanguka kwa moto, at times unaanguka kwa barabara.
Yeah, so from 2014 haikuwa mbaya sana, 2014, 2015. But 2015 September I joined school in KU. So hapo tena ikawa imeanza kubadilika sasa.
Yeah.
Nilikuwa wakati niko nje ilikuwa sawa, but wakati niliingia shule maisha ikawa tena ni kama tofauti. Kuna vile inanifinyilia ama na feel siko vile nafaa kuwa. Nikawa ndio nimepelekwa shule but sometime ikawa ngumu kwa mzazi kusatisfy kila kitu chenye nahitaji kuwa shule.
Okay.
Yeye ndio atalipa fee, lakini mahali pengine unajikuta unahitaji kujitafutia chakula, unahitaji kulipa rent. So ikawa pia hizo ni vitu zimeanza kuja kwa kichwa, stress. Ikawa sasa imekuwa mbaya. Ndio na meza dawa, lakini siwezi kuzuia ifanyike kwa sababu ya vile mafikira mengi. Wakati mwingine hauko shule unatafuta, wakati mwingine unaenda shule lakini unajua jioni nahitaji kukula. Ama mwisho wa mwezi imefika, landlord anahitaji rent. So hiyo mafikira yote ikawa inaleta, wakati mwingine niko kwa nyumba peke yangu napika, naanguka hapo na labda nachomeka. And nishachomeka mara mwaso that 2016 ilifanyika sana. Those accidents zilifanyika sana. Nikawa hiyo wakati wa kutafuta niliingia kwa biashara. Wakati mwingine niko mjengo, niko shule. So pale mahali unafanya kazi labda jiwe linakuangukia, unashikwa tu na hiyo siza ukiwa umebeba jiwe, ukianguka jiwe linakuangukia. Naumia. Nikaachana na hiyo nikaenda kufanya biashara ya kupika mandazi kuuzia wanafunzi. Hapo tena niko peke yangu tu asubuhi, nikachomeka, nikaanguka kwa hiyo mafuta nikachomeka. So ikawa nikaa inaendelea kuongeza badala ya kureduce. Kwa sababu ya hizo stress, vitu zenye nafanya, zikawa ni risk kwangu. Lakini ilikuwa tu, sasa ikawa maisha ni tofauti kabisa na mimi. Nikafika mahali, nikaanza kujiuliza kwa nini naishi. Kwa sababu sasa imekuwa ngumu kabisa, siwezi. Na pia naweza sema wazazi hawakuwa naelewa sababu ya hizi vitu zote kufanyika. Na kila nilipokuwa nikijaribu kuelezea, baada ya kuelezea waelewe, ilikuwa inakuwa ngumu sana. Ikawa wanahitaji mtu mwenye angewaelezea. Walifika nikawa waka lose interest ama wao wakachoka. Wakaona ni kama nimewachokesha. Sasa ikawa wanahitaji mtu mwenye anawaelezea zaidi. Unajua ukifika mahali unaona the person close to you
Yeah,
ndio ni kama
doesn't understand.
hayuko karibu na wewe, unafika unafikiria suicide thoughts zikawa ndizo ziko tu kwa akili sasa. Yeah.
Did you try to act on it?
Yes, I tried twice.
I'm sorry.
Kwa sababu ilifika ikakuwa vigumu sana. Yani naona ni kama siwezi kuishi. Nilikuwa nikitegemea marafiki sana. Tukiwa na marafiki ndio niko sawa. Lakini kama niko peke yangu, jua mchana uko shule, uko na marafiki. Lakini ukifika kwa nyumba uko peke yako. So hapo mara ya kwanza nilijikuta mwenyewe nikitaka tu kujitoa uhai nikitumia kisu. Fortunately rafiki yangu akakuja that time yenye nataka kufanya hivyo. Na sikuendelea, tukakaa na yeye until wakati nisikia nimechoka, nimeshikwa na usingizi, nikalala tu. 3 days later again nilijaribu kutumia kamba, but tena yeye mwenyewe akawa amekuja tu, the same friend akakuja. Sasa kutoka hapo ndio tena nikawa nabaki kujiuliza ni nini nataka kufanya. Kwa nini nifanye hivi? Nikawa nikisema nitafight tu, vile itakuwa ikue, I will fight. So there are groups ambao walikuja karibu kunisaidia that time nilikuwa shule. So kuna watu those people ambao tulikuwa tunaishi nao walikuja wakaanza kunisaidia kidogo kidogo, wengine wananipea chakula, wengine wananilipia rent. Ndio ikawa ni rahisi. At least maisha ikarudi kidogo, ikatulia, cause ilini affect hata shule. Studies zilifika zikakuwa sasa hata mwalimu amenotice hakuna hata mtihani, ikawa nilianguka mtihani mara 3. Like mtihani ya kwanza ilikuwa inakuja sifanyi kitu, ya pili sifanyi kitu, until mwalimu alinotice kuna shida. Na wakati aliniita nikaenda nikamuelezea vile iko. Sasa yeye ndiye alianza kunipeleka counseling. Akanipeleka counseling, akaniambia niwe naenda kumuona na pia niwe naenda counseling. At least nikaanza kufeel kuna utulivu fulani. Nimeanza kuona mtu mwenye ako karibu na mimi. Ndio nikaanza kuchange. So I've been through that until nikamaliza shule. There are other people pia walikuja, nilipata an organization ilikuwa inaitwa Kamili. Earlier on nilikuwa nanunua medicine. So pia hiyo ilikuwa shida. Unafikiria kukula, unafikiria nyumba, pia medicine yenyewe unanunua. Sometime ningeacha kuitumia cause sina pesa. Mtu anaweza ona nikaa nimeacha kutumia medicine, lakini unajikuta uko na 100, unahitaji medicine, unahitaji kukula. So una have kuchoose kukula. Because hata hizi medicine wakati mwingine zinahitaji ukule ndio ukunywe. Sasa kama hujakula tena ni effect, iko na side effect. So ikawa nanunua, lakini wakati nilikutana na organization inaitwa Kamili, wao wanapeana bure. So nilikuwa naenda huko, nachukua hizo medicine for free, na zilinisaidia sana. At least nikawa hiyo budget ya kusema nachukua medicine na kununua ikapungua. So nimekuwa nao kuanzia hiyo 2016 kielekea kuisha, ndio nimekuwa nikienda nikichukua huko until now. Huwa nachukua huko. Na around 2018 ikienda kuisha, pia I was introduced to another organization inaitwa Cheshire. They support people with disability, mostly mental. So niliintroduciwa huko na it's a support group. So tukaform a support group yenye huwa tuna meet people with different mental disabilities. Na kule nimesaidika sana. At least nimefeel siko peke yangu. Na pia ilinisaidia kujikubali. Mapema haikukuwa rahisi kusema niko na hiyo shida. Hata singesimama kwa watu kuongea. Ilikuwa very hard kusema kuna hiyo shida. But after kuintroduciwa kwa hiyo Cheshire, nimekutana na watu wengi, nimejua watu wengi, that support. Pia wametusupport wao, wanasupport kuanzishia biashara, na pia wanakusupport wanapeleka watu wengine shule, wanalipa fees. So imekuwa, hata mimi wamenisaidia. Wamenisaidia sana. Ikawa ni easy sasa kwangu.
Yeah, because for you mostly ilikuwa triggered na stress, like if if you're stressed, in a trigger, depression triggers, of course, the seizures. Yeah. Okay, then. I'm really glad for your friend who always came in at the right time, to help you out on this thing. Okay, then. So, Dr. Joshua, I mean, from what he's saying, and I think so many people can relate, and not only for his condition, but on so many levels. Sometimes when you're going through something, and the people that you expect to be there for you are not there for you, sometimes it's I mean, those thoughts can come around. Sure. So can we talk about then the support, and not only from the people around you, but even the society in general, just that understanding of epilepsy, what it is, and the risk that one is exposed to once they have epilepsy. Can we just talk about that? So that at the end of the day, when someone, let's say, has a seizure, like he said, sometimes he would be on the road and anguka, nobody knows what's going on. So sometimes in the event that one has a seizure, at least we know what to do. So can we just talk about how important support is? Yeah.
For support, I would again say, just as I mentioned earlier, that anyone living with epilepsy is already at a high risk of depression.
Yeah.
The disease itself is a risk factor for depression.
For depression, yeah.
And so, just like any other disease, these people need more than just the drugs. They need more than just the physical care that we give. So, when it comes to support, the first people, of course, you would expect to support are your family and friends. Unfortunately, as it happens many times, the same people may not actually be there to support you. Sure. Either because they are not well educated about your disease, or for whatever other reasons, they may have perhaps other engagements or so. But generally, as a society, what the kind of thing we can do at a societal level is to be able to, first of all, shake off the stigma that's associated with epilepsy.
Yeah.
The person living with epilepsy is not possessed. They're just having a physical disease like any other. And so they need the support to be understood. They need to be understood and to be made known. It should be made known that they can also live a complete life, full lifespan, and do as much as anybody else, of course, with the necessary support. So other things that probably may be done, like he's mentioned, sometimes the drugs are expensive for most people because they cannot afford it. And so that may be something as an individual you might not have a lot of control with, but the government could step in to either subsidize the drugs or organizations like he's mentioned that could give for free, go a long way to help the person to live, at least to manage the condition. Yeah.
Okay. And then again, I like that aspect because I see at the end of the day, this person has to take medication for what, twice a day, or is it thrice a day for quite some time until the doctor says, oh, well, we can reduce the dose. But from what Festus said is that sometimes they had to increase his dose a little bit. So again, it can, from what you're saying, it can be quite expensive. All right, then can we talk about diagnosis? Because I can see our time is far much spent. Diagnosis and the difference, because you talked about an aspect of if one has a phone and if you're able to, if you have someone else by you, you can probably record so that the doctor knows the kind of seizure, whether it's simple, complex, partial, or generalized. So can we talk about then those, and does that inform then the kind of treatment, either medication that one is administered to?
Yeah. So the first thing when I get a patient at Bliss Clinic, the first thing I would want to know is their story. What's the story of the
story? Yeah.
So maybe the common things we want to know is was there any if their children, anything that happened wrong during their birth or pregnancy, or if they've ever had those diseases that I mentioned, anything that could point to a cause of the convulsion. And then once you've done that, many times we will also send them for some tests And then, unfortunately, for our country, some of these tests are not available, or maybe they're expensive. You know, sometimes you may want to do an imaging of the brain, maybe a CT scan or the MRI, but the cost could be prohibitive, or they're not there in some parts of this country. And then there's also a test we call an EEG. Basically, it measures the electrical activity of the brain. And so that also informs us to know what type of abnormality is there. Yeah. So once we've done this test and everything, we will start the person on medication. Depending on the type of epilepsy they have, sometimes the drugs may differ. And even the treatment approach could differ. So we usually have what, the classification is different, but generally we have what we call the partial and the generalized. So in a simple term, generalized means it's affecting the entire brain, all sides of the brain. Partial means it's affecting a particular part of the brain. Yes, so if it affects, let's say, a particular part of the brain that controls your left side, you may only see the conversion on the left side. Or the one that controls your sense of smell, for example, you may also have it coming with disordered sense of smell or hallucinations if it affects your memory or such kind of things. Generalized, on the other hand, may affect your entire body and you may lose consciousness. And so generally that's how broadly we categorize them. Of course, again, under partial, we may have what we call complex and simple, but that's maybe getting into a lot of detail.
Technical.
So as I said, sometimes, especially even if for very young children or for somebody who's never been known to be epileptic, sometimes what will help, as I mentioned earlier, if you've had someone who recorded that conversion, it could also help the doctor to know exactly that they've actually also witnessed, you've allowed them to witness the conversion. And so these patients would be started ideally on treatment. Usually we start them on one drug, perhaps at the lowest dose. And depending on how frequent the conversions are happening, you can raise the dose or you can increase another type of drug to that treatment. And then other treatment options, especially for those who are now having intractable seizures, there are also some surgical options. So some people will actually need surgery to either remove some part of the affected brain and that kind of thing. So you could also need surgery in some cases of epilepsy.
But that is, could we say that is more on the severe?
That's now very extreme. You've tried medication and it's not working, and the tests that have been done can point to a particular part of the brain that could actually be sorted out surgically. And in some people, even the surgical itself does not really stop the seizures. It's just to reduce the frequency of seizures.
All right. Does it ever go away on its own?
Well, I would say maybe the question is, can you get cured?
Yes.
And it's not really a yes or no answer. The goal of treatment is to have this person seizure-free. That's the goal of treatment.
Manage,
And if they've been seizure-free for a number of years, they can actually live without medication at all. And when they're living without medication, well, we wouldn't say they're really cured. They're still at a risk of developing it. But there's actually people who can be started on treatment and after a number of years be taken out of treatment and continue living without seizures and without any medication. So loosely we could say there are people who get cured, but then they're still at a risk
of getting
other episodes.
All right, so for you, Festus, now that unajua what triggers it, and sometimes you know when it's about to happen, but sometimes you do not have control over. Before you know it, you're already having a seizure. Are there things that you've had to change, like in your life? For instance, first of all, nikikuwa na stress, nikikuwa depressed, I will get a seizure. So are there things that maybe in life imebidi ubadilishe, either thoughts, either how you carry yourself, usikasirike sana? Are there things that you've had to change?
Nimehave kuchange vitu nyingi sana, ndio at least nijue nikifanya hii haitafanyika. For example, nimehave sasa kujikubali kuwa mali imefikia niko peke yangu. Na lazima ni mimi, hata kama kuna mtu wako kando yangu atanisaidia, ni mimi mwenyewe
kwanza.
Lazima mimi mwenyewe nijikubali, lazima mimi mwenyewe niondoe hizo thoughts kuwa inafanyika ama itafanyika, na pia nikubali kuwa sio kila wakati kila mtu ambaye unahitaji atakuwa karibu na wewe. So lazima nikubali ni mimi na ni mimi mwenyewe nitafanya nipone, si mtu mwingine atakuja. Another thing imekuwa nimeanza kujikeep very busy, ndio at least nisikue mahali nitakaa nifikirie. Yeah, sometime when I'm not doing business huwa napenda athletics sana, so najikuta nimeenda kwa uwanja kukimbia. Also nilianza kujiinvolve na watoto sana. I love kids. So sometime wananifanya nakuwa ile furaha tu, ile yenye unaangalia mtoto unaona huyu mtoto anakaa innocent kabisa, hana story, huwa na so niliingia kuwa mwalimu St. Stephen Church, mwalimu wa watoto. Is a group, ni kikundi kinaitwa PMC. So huwa nawafunza Saturday, Sunday, huwa nawafunza mambo na chorovers, poems hizo. So nikawa niko busy, ni keep very busy, like hata ukimalizana nao kutoka kanisani, kuna kitu nakumbuka about the kids ukiwa kwa nyumba, ama kuna kitu nataka the following time utarudi huko, utafanya kitu ingine. So that time mind yako iko hapo. Always niko kwa positive thoughts. At least nimejaribu kubadilisha hiyo imenifanya sahi siko sana kwa hiyo minds mbaya ama nafikiria sana. Nimeondoa hizo stress kwa sababu ya hiyo, na pia kujiinvolve mostly kwa mambo na film acting. Nimefanya nimeondoa hizo thoughts sana.
Keep yourself busy and all those things, and avoid the triggers. You know your triggers, so avoid them. All right, so can we get your passing shots, Dr. in like 30 seconds, and for you PFS does in like 20 seconds. Just in case someone is out there akona mtoto probably ako epileptic, what can they do kuwasaidia? Very briefly, like 30 seconds each. We'll start with you, Dr.
So what I will say is get to know as much about the disease as possible, either as a parent or the caregiver, or even as the patient. And then number two, if you're on medication, be faithful with your medication. And of course, as Festus has said, avoid any triggers that you know of. If you know your triggers, avoid them. So I think that's my parting shot.
All
really.
Right. Thank you very much, Dr. Oro.
Thank you.
Festus, mzazi yako na mtoto epileptic?
Kwangu mimi naweza sema wazazi wakiwa na watoto wasiwaweke kwa nyumba, wajaribu kuwatoa. Wazazi wengi wameficha watoto. Alafu pia ningeomba serikali itafute njia ya kueleza watu kule mitaani hawajui kuhusu huu ugonjwa, waelezee ni nini haswa hii ugonjwa inahusu. Ndio mzazi asiwe anajificha. Alafu pia napenda kushukuru nyinyi haswa kwa kuninvite ndio nikuje niambie watu. Alafu pia wale wenye wamekuwa nje na mimi kunisaidia, wote nawashukuru. Vivian, Jacinta na wengine. Asante.
All right. And hata sisi tunakushukuru. Thank you very much for coming by, because it's not easy. Not everybody atakuja tu aseme, listen, this is what I'm living with and this is my life in brief. So thank you very much. Festus as well. Dr. Joshua, again, thank you so much for coming by today. And of course, thank you so much for staying with us as well until the end of the show. Now, I believe that you have a better understanding as far as epilepsy is concerned. And like Festus said, if you have a child who is epileptic, please do not lock them in. Do not. Just try as much as possible and help. And as a society in general, let's try and be empathetic, understand one another, so that at the end of the day, we might help fight, especially stigma that surrounds epilepsy. My name is Winnie Lubambe. On behalf of an amazing, amazing team who put together this show, we wish you a lovely day ahead. We'll see you again tomorrow, same time, same place, for another dose of My Doctor. But for now, it's a goodbye. God bless. See you tomorrow.